Hello, my name is Caitlin DeShazer, and today I would like to present an idea to Mayor Rhodes Conway that can help Madison's homeless population during this unprecedented time. In terms of behavioral assumptions, which is an expression that is typically coined in business and economics, businesses are likely to maximize their profits with whatever resources are available to increase outcomes. Although this is not a business per se, the City of Madison needs to utilize outside resources to increase favorable outcomes in terms of the pandemic. By providing protective equipment, the City of Madison would also help to decrease the spread of COVID 19 and protect a very vulnerable population. Mayor Satya Rhodes Conway, back in August, released a statement concerning the actions that have been taken to protect the homeless population. Local hotels have been utilized to decrease the number of people in homeless shelters, which alleviates the inability of shelters to abide by CDC guidelines. Although this action was helpful, it is not one that is attainable in the long term. I would like to confer on a plan that would supply the 295 plus homeless people with protective equipment. Since there is a lack of access to shelter, there is an increased risk of contracting and spreading coronavirus. This may be dangerous for those who walk the streets, but most importantly, it is dangerous for many homeless people that have underlying health conditions or are older adults, according to the Center for Disease Control and Prevention. As winter approaches swiftly, there is an increased need to seek shelter, which makes social distancing arduous to maintain. As of 2019, 4,538 people were homeless, but of that number, 295 were unsheltered. The unsheltered homeless are typically those who reside in places that are not suitable for human habitation, such as parking garages or abandoned buildings. As much as homeless shelters are providing for the majority, there still needs to be support for the minority that are not seeking shelter with these services. Two specific shelters that I spoke with, the Beacon and Briar Patch Youth Services, both noted how the pandemic has affected how they operate and how they are able to provide services. Both recounted the difficulty of providing services that would otherwise be in person, as well as the need to reduce or relocate people. Briar Patch cut the amount of youth that they let stay there in half, while the Beacon has combined homeless shelters and relocated different groups within the homeless population. Neither shelter has had issues obtaining masks and hand sanitizer, either due to help from the CDC or the help of donations. Thankfully, there was not much of a shortage of the necessities, but that may not be the same for those who do not seek shelter at locations like these. For those who remain unsheltered, I believe that it is important to ensure that there is information available in regards to the virus. Putting up an infographic that is easily accessible and understandable is an option that I would like to cover. The infographic, made by Ecolab, is well constructed and provides necessary details. This infographic can be posted around Madison so that it is public and readily available. When people are informed, they make better decisions with what resources they have available. As well as this, I also believe that it would be beneficial to provide reusable masks and hand sanitizer to the small population. Although the last count accounted for 295 unsheltered homeless persons, I believe that this number may be higher due to the strain that the pandemic has put on people's financial situations. I would raise the number to 350 to give some leeway, so with 700 reusable masks, it would total out to $535. Instead of surgical masks, reusable masks are easy to wash and use again. 2 would allow people to rotate between the two and be able to wash them when they are dirty. Like masks, hand sanitizer is also a necessity. To provide for about 350 people with 2 hand sanitizers, it would total out to $779.61. Even though putting people in hotels is a great idea, it doesn't account for the fact that there are people without proper protective equipment. As lovely as it would be to end homelessness, I know that this is an issue that is bigger than the pandemic. By providing masks and hand sanitizer, we can limit the spread of the virus and encourage precautionary measures. All in all, as we sit here and watch this presentation, I would like to end with these 3 pictures. This is the reality for many. Sleeping and inhabiting places that are unsafe and not clean during a pandemic might as well be the worst. With temperatures dropping and the pandemic well alive, these conditions are highly unsafe. By providing masks and hand sanitizer, as well as spreading the correct information surrounding the virus, we are helping one problem at a time. Although providing the items and information does not end homelessness, it is a way to protect the homeless from a danger that is imminent and already spreading. With this in mind, I ask you to consider the ideas that I have put forth, either with or without the continued use of local hotels, in order to protect a population of people who are highly vulnerable. In doing so, we are helping decrease the spread and ensure that all are accounted for, including those who do not have the means to do so themselves. Thank you.